Hello, and welcome to Bryan College of Health Sciences virtual pinning ceremony. My name is Dr. Teresa Delahoyd, and I am the Dean of Undergraduate Nursing for the Bachelor of Science in Nursing program. On behalf of the faculty, staff, and administration, we are excited to have you participating in this special pinning celebration, honoring the class of May 2023. Although the current pandemic did not allow for all of us to gather in one place, we are happy you could join us virtually. I would like to thank all of the students for their flexibility as we organized this ceremony in a very different modality. We appreciate your willingness to adapt to change as we strive to keep everyone safe. I would also like to recognize and thank all of the college administration, college staff, members of our college board, and especially our nursing faculty for their dedication to the success of our students. It is the commitment of our entire team to the college's mission of academic and clinical excellence that allows us to provide for a quality education for all of our students. And a special thank you to each and every family member and friend for your continued support of the students in the class of May 2023. Thank you. The traditional nurse pinning ceremony is deeply rooted in nursing tradition. To better understand the significance of this ceremony, I would like to share with you a little history about the founder of nursing, Florence Nightingale. Often called the Lady with the Lamp, Florence Nightingale was a caring nurse and leader. She is most widely known for making hospitals a cleaner and safer place to be. Florence was born on May 12, 1820, and when she decided to become a nurse, her parents did not approve of her decision. At this time in history, nursing was not a respected profession. However, her father eventually allowed her to receive training, and by the time she was 33, Florence Nightingale was making a name for herself in the nursing community throughout London. When the Crimean War began in 1854, the Secretary of War asked Nightingale to manage a group of 38 nurses to help treat the wounded soldiers. The nurses provided individualized care and support to the soldiers and brought supplies, nutritious food, cleanliness, and sanitation to the military hospital. Nightingale was known for carrying a lamp and checking on the soldiers at night, so this is when she was given the nickname, the Lady with the Lamp. When Nightingale returned from the war, she continued to improve the conditions of hospitals. She published a book called Notes on Nursing, What It Is and What It Is Not. Her book gives advice on good patient care and safe hospital environments, something we continue to strive for even today. Nightingale continued to advocate for safe nursing practices until her death. Today, we honor Florence and the work she did to pave the future of nursing. To continue Florence's legacy, each student being pinned today will also pledge to provide safe care to all patients. Students, this pinning ceremony is not only a celebration of the impact nurses make on a daily basis, but it is also a celebration of the progress you've each made in the program on your path toward earning a bachelor's degree in nursing. At this time, I would like to review the meaning of the pin each student has received. The pin depicts the conceptual framework for the Bachelor of Science in Nursing curriculum. It is composed of 8 interrelated concepts: collaboration, critical thinking, leadership, information management, person-centered care, safety, health, and global community. Person-centered care is the unifying concept and therefore is centrally located within the model. Collaboration, critical thinking, leadership, and information management are processes used by nurses every day to achieve the desired outcomes of health, safety, and person-centered care. Health and global community are variables influencing both the processes and outcomes of nursing care. Students, you have already seen firsthand in the clinical setting how each concept in our conceptual framework is utilized to provide excellence in patient care. And never before in our lifetime has the term global community had more meaning than right now as our world works to contain this pandemic. Students, as you progress on this journey, you will continue to learn and grow while living out Bryan College of Health Sciences' core values of integrity, caring, equity, and learning. We hope you will wear your pin with pride knowing what it represents about our BSN program and the nursing profession.
Hello, my name is Sassy Chase, and first I would like to say thank you to my fellow students who invited me to speak on behalf of the class of May 2023. It means a lot to be able to speak on this milestone and in our careers as students pursuing a career of nursing. The first thank you I'd like to give is to our family and friends. They're the first-hand viewers of our hard work that we're putting into our schooling every day. They see the long days, the sleepless nights, the endless studying and prep work that marks the beginning of our clinical experience. Thank you for supporting us, and an even bigger thank you to those that have pinned their student. While it may feel little to you, the support you give us, the encouraging words, a small text or short call to check up on us, and the hugs after a long day, week, or month makes an even bigger difference to us than you'll ever know. My next thank you is to our faculty. The pandemic of COVID-19 has put a wrench in our plans time and time again, but your flexibility and dedication to students has made the transition to the new learning environment seamless and easy. To our professors, we recognize the hard work you put in every day to make sure that we're learning as much as possible to ensure that we're successful in our future endeavors. We see how much you want us to succeed, and it encourages us every day to keep persevering. Thank you for teaching, guiding, and encouraging us. Last, I would like to say thank you and congratulations to my fellow students. We're officially halfway there in our college career. We're no longer caring for patients that we only see on paper. We're seeing and caring for real people. It may seem little or just a casual step in our degree, but it's way more than that, and it's something that should be celebrated. In 2 short years, we'll be caring for patients of our own, by ourselves, without the faculty and our classmates around us. It sounds scary and so far away, but just like this milestone, it will creep up on us. And we'll be standing at graduation with one another, wondering where the time went. In only 2 years, we will all reach our floors or clinics confident, with a strong foundation of learning, riddled with nervousness and excitement. Our futures will all look different. Some will go to labor and delivery, some to emergency trauma, ICU, progressive, rehabilitation centers, and many more possibilities. But our foundation will be the same, and our time together will be difficult to forget. We've experienced the laughs and the cries, the good and the bad, the excitement and the worrying, all as one. As most of you know, this will hopefully be my second bachelor's degree that I'll be completing, and I can easily say this is the closest and most tightly knit I have ever been with my classmates and cohort. We share frustrations, celebrate each other's accomplishments, and truly care for one another as humans. As someone who's on the older side of our age differences, I can honestly say I am confident in the abilities of each of my classmates in being confident, caring, and strong nurses. You're entering a physically, mentally, and emotionally challenging field. Not many people would just choose this career. We see the saddest days. We watch someone get the worst news of their life. We watch the heartache of a family as loved ones go through pain, and sometimes we're the last hand they hold when they reach their end of life. But we also get to see the happiest days of our patients. We get to be there when they get that diagnosis, the news of the cured diagnosis. We get to tell them they're going home with their family healthy and renewed, or we see a new life enter the world. I encourage you all to remember what drew you to this career. Remember why you chose this path when the days seem a little darker. Think about the difference you've made in all the lives that you've touched. The hard work will be worth it. I can promise all of you that. I'm so proud of each and every one of you, and I cannot wait to see what each of your futures hold. Thank you.
Thank you, Sassy, for your wonderful message. At this time, I would ask that all nursing students recite the pledge to the nursing profession with me. Today, I pledge to accept the responsibilities and expectations associated with the nursing profession as stated in the Nursing Code of Ethics. I will strive to care for my patients and families at the highest level of competence through my knowledge and skills. I recognize the need to maintain confidential information entrusted to me while respecting cultural, religious, and personal beliefs when providing care. I will be an active member of the healthcare team to ensure quality patient outcomes. As a member of the team, I will respect others while upholding the highest standards of professional and personal integrity through my actions and words. From this day forward, I will strive to maximize my potential as a nurse while upholding the standards of the nursing profession. In addition, I devote myself to the welfare of those committed to my care. In closing, I wanted to read this short poem to you. The author is unknown. You will be mentally stressed. You will be emotionally challenged. You will learn how to work together. You will learn to work alone. You will learn to speak. You will learn to be silent. You will learn to lead. You will learn to follow. You will be constructively criticized. You will be praised. You will shed a few tears. You will share in each other's laughter. You will learn the need to help each other. You will learn to help yourself. You will learn to be part of a group. You will learn to be yourself, an individual. You will learn responsibility. You will learn discipline. You will learn these things because one day someone's life will depend on you. You are a nursing student. You will graduate, and you will be, in all its wonder and glory, a nurse. Congratulations again to the class of May 2023. We look forward to what the future holds for you. Thank you for joining us for this virtual ceremony.